This video is going to give an overview of the ethical considerations that go into epidemiological research. So a lot of the ethical standards that people who do epidemiological research, and really research in general, especially in Canada, is governed by the three main funding agencies that they call the Tri-Council. And the three funding agencies basically cover like the three major areas of research. So like social sciences and humanities, and I imagine like arts as well, has its own, I guess, agency that grants all the funding for research related to that. CIHR is the one like that is very health related and would encompass epidemiology, and NSERC covers pretty much all the other like sciences and maths and stuff. So basically, they control the money, and that is a good. They're in a good position basically to also uphold the ethical standards by making it basically a requirement to get funding that you meet their ethical standards. And they have basically a bunch of tenets that are going to kind of guide the direction of this video. So one of the fundamental tenets is that the research has to have the potential to advance human welfare or knowledge. And that means that should be the primary goal, even if those involved in the study might be subjected to some invasive procedures. Like the ultimate goal needs to be to advance basically our understanding of whatever illness that we're studying. And yeah, basically, even if like all your intentions were good, if it's very unlikely that you'll find an association, that might be because your study's underpowered. You don't have enough people to be able to detect a statistical association. That would be a situation where the research doesn't really have the potential to advance human welfare, and in that sense, it's unethical to put people through that for no reason. Respect for human dignity is the next big one, where respect for bodily integrity, basically they break it down into a few different things about what that means. So bodily integrity would be a main one, where like you're not, I guess, injuring people in a permanent way for the purpose of research. Psychosocial integrity, so I guess that's more to do with like psychological studies, in the sense that you shouldn't subject them to something so traumatic that it's going to have lasting effects. And cultural integrity, where basically you don't make people debase themselves culturally, basically by participating in the study. You shouldn't make them do anything that goes against their cultural values or anything like that. Free and informed consent is a big one. So you need to obtain consent before research begins. Basically, it should be like the first thing you do when you're recruiting a participant. Consent needs to be informed. So there's a difference between just having them like consent and sign something and explaining to them what participation is going to look like, and then having them consent. So basically, you need to explain exactly what they're going to be subjected to when they participate. You need to emphasize that participation is voluntary, not only at the sign-up stage, but also they can withdraw any time. They also need to be capable of giving consent, and there's certain populations and certain circumstances where someone might not be able to give consent, like someone who's underage, someone who is like under the influence of various like substances, if they're intoxicated, people with cognitive disabilities. Those are all situations where it might not be possible to get consent from that person. And yeah, so that's basically what I was just saying. But you can often get consent by proxy, in the sense that whoever their caregiver is, in the case of minors and those with cognitive disabilities, they might be able to give consent on the individual's behalf. Respect for vulnerable persons is kind of in line with what I was just talking about, where basically people who are considered vulnerable get special consideration in the research process, because this would include those that are socially or cognitively disadvantaged, and these people basically, that also, I'm going to have a list after this of people that are considered vulnerable. Basically, these people have diminished decision-making capabilities and are more likely to be manipulated, in the sense that they, I don't know, the things that they agree to do might be just because someone is telling them to. Basically, that they might have diminished agency over their best interests, and basically they need to be looked out for a little more, as far as making sure that the research processes and taking advantage of them in some way. So some examples of that are like people who are underage, people with cognitive disabilities, those with mental illness, babies, obviously, the very old, the economically disadvantaged, and prisoners. Proxy by consent fits in for some of these, such as minors and those with cognitive disabilities. People of low socioeconomic status is an interesting one, where if you provide like a large financial compensation, like $200 or something for participating, it can be considered unethical if someone is of extremely low socioeconomic status, because you're basically coercing them to participate, and you're putting a conflict in front of them where this financial incentive might outweigh a lot of things. Basically, like it might cause them to like do things that do kind of basically like come into conflict with their like some of the cultural integrity debasing things I was talking about before, where dangling a lot of money in front of someone who needs it to survive is basically they're not consenting. They're willing to put themselves through harm for that, basically, and that's not fair. Respect for privacy and confidentiality, so control over who has access to the information. So if you have like a spreadsheet somewhere that might have codes attached to people, that would be ideally how you would do it, where you transfer any identifying information like names into codes. And you need to be able to anticipate times when you might need to breach this confidentiality. So for example, like if someone through some psychological study kind of admits to wanting to hurt themselves or others, or having already, that might be a situation where you need to basically, like, you have an obligation to tell someone about that. And that's something you need to plan for, as opposed to responding to it when it happens. It's more something you might work into the informed consent process. Distributive justice, that's basically the principle that like both the benefits and harms of the study are being evenly distributed. So you're not like giving people of a demographic, you're partial to the better treatment, and people you have something against the worse treatment. Also, like, basically you just need to have a fair distribution of benefits and harms or burdens. So for example, like invasive research with a really high potential to improve health, it would be unethical to include only those with disabilities, unless like that's obviously the goal. But it would also be unethical to completely exclude this demographic, because then basically they don't benefit from any of the findings, where it might not be generalizable to them in some ways, where if you had included some people with disabilities in the study, then basically the results would be generalizable to that population, and they could reap the benefits of whatever came out of that research. Balancing harms and benefits, so ideally the benefits outweigh the harms for both the participants involved, which isn't always possible. Sometimes you need to subject patients to invasive procedures, but ultimately, like, there's things you can provide them that are benefits, things like like being able to identify disease when it happens in a way that they might not have had before, being able to identify exposures that they have been exposed to, I guess some financial incentive for them maybe, and also just sharing with them the results. Minimizing harm, so only using human participants if it's essential. If you can use an animal model or cells or something else, then that might be a better option. And if you need to use human participants, figure out the exact amount you will need to get the basically statistical power that you anticipate needing to find an association. And if you lose people to follow up, it's also unethical to not take action to preserve that power, where if you're losing a lot of people over time, you're less and less likely to be able to detect an effect, and you're basically making the sacrifice that people put in earlier in the study for nothing. And if it's possible to choose a less invasive test, that would be ideal. Research ethics boards, they exist at most universities, and they're basically like a requirement to get funding for your research, and also to basically carry out research. I haven't done a lot of this, but I think it basically is required for almost everything, especially if it involves people. And basically, for situations where people aren't involved whatsoever, like you're just using historical data or something, you would still need to go through this process, but it would likely be expedited in the sense that it's judged to have minimal risk. But basically, the researcher doesn't get to decide what is minimal risk. It's more up to this research ethics board, which is usually very multidisciplinary and might even have like members of the public that aren't affiliated with the university. And yeah, it's a valuable thing. The responsibility to share findings. This is an issue lately, just with publication bias, where people aren't publishing things that aren't interesting, and that kind of messes up meta-analysis and other like knowledge syntheses, where you're trying to like find a bunch of studies that investigated the same exposure and outcome and basically like average the results. And if you are selectively not publishing things that have a non-significant result, basically you can end up skewing the overall picture when people consider all the studies that were published together. And there can be obligations to share certain results with participants. So if they're exposed to something dangerous or a severe outcome, or there's some basically important study findings, it might be considered an obligation to share that with participants. The last thing I'm going to talk about is equipoise, and that's a principle in randomized control trials where basically you can't knowingly give someone an inferior treatment. Something you might have heard of is like the treatment group and the placebo group. A placebo basically is like a fake pill. It's so the participant doesn't know if they got the real pill or not. Because if basically you just tell someone they're in the control group, or even if you don't tell them they're in the control group, but they know it's a pill, and you don't give them something to take, they're going to know which group they're in, and that might basically influence a lot of the way they behave and maybe even their physiology. So equipoise is basically only appropriate when there's no standard treatment. So like when there's some disease that has no accepted treatment, then you can give a placebo, because technically we don't even know if this new treatment is we don't even know if a placebo is inferior to this new treatment. It might be just as good as a lack of treatment, this new treatment we've come up with. But when a standard exists, like if we're looking at some new cancer drug and there's many current cancer therapies, then you can't use a placebo. You need to use whatever the standard treatment is. And you need to plan to intermittently analyze the results, and as soon as you have enough evidence that one treatment is more effective than the other, you can't ethically continue the study, because then as of that moment you're willingly giving people an inferior treatment, which isn't allowed basically.